like to introduce the SCOI classroom. Classroom is a name that we've given our training center. It stands for Center for Learning Arthroscopic Skills. The classroom is one of a kind, I think, in the world. Built by the SCOI shoulder team with the help of many special sponsors from industry and from other patients. The classroom is a place where anybody interested in shoulder arthroscopy, be they a surgical tech, fellow, visitor, doctor in training, can come to test new equipment or to practice, rehearse, and perfect their surgical skills. We've used the classroom along with the various simulators and models that we've accumulated here to test all kinds of new equipment, to develop surgical techniques, and to train hundreds, if not thousands, of young doctors in the important skills necessary to do shoulder arthroscopy. Some of you may be interested in seeing the classroom, and some of you may be interested in using it as part of your charitable giving. It's a not-for-profit organization and certainly tax-deductible, and we'd be happy to provide you information for that. We're very proud of it, and we love sharing the classroom with anybody who's interested. What I'd like to do now is just give you a little introduction to arthroscopy. Arthroscopy is the way we do all of our surgery on the shoulder team. The most important tool, of course, is the arthroscope. Arthroscope is nothing but a telescope. You see it's about the size of a small ballpoint pen. It has a sheath that goes inside and a little spigot on the side where water is attached. So we put water into the scope and it fills the shoulder so that we have lots of room. We also have a light cord attached, and the light cord causes light to be emitted from the fiber optics at the end of the scope. This end has a very important high-definition 3-chip digital video camera, and the camera connects to the scope and is sterile, and so it can be used on the field. Now you'll notice that the scope can be turned in different directions, but in order to see back on itself, we have to have 2 portals in the shoulder. This is a shoulder model, and this is one of the shoulder models we use in the classroom for training. We've placed 2 portals in the shoulder. These are called cannulas, and we can put the scope in one of those, and it goes right in the shoulder with no trauma. And through the other portal, we can place our instruments. This happens to be a small grasping tool. And you can see how with the scope, these are magnified so much that we can do very delicate surgery. So we do our surgery by looking at the video monitor, and we can use the tool to manipulate the tissues and to install different things to repair torn tissues. Now, in order to fix something that's torn in the shoulder, we usually have to use what we call suture anchors. Everybody knows what a suture is, a stitch, but a suture anchor is a device that allows us to fix the stitch into a bone. So say, for instance, you have a torn rotator cuff or a torn biceps or a torn labrum. We use a suture anchor. In the case of the rotator cuff, we use a metal anchor, and the anchor goes in the bone and then fixes the suture material to the bone. We can then take a stitching device and pass one of the or more of the 3 sutures that are in the anchor through the torn tissue, and then by tying the sutures together, we can fix them down to bone. If we have a smaller tissue injury, like for instance the labrum or a slap lesion, we use a different type of anchor. This little purple anchor is called a bioabsorbable anchor. It only has 1 or sometimes 2 sutures in the eyelet. We use that in what we call the glenoid bone, or the bone that makes up the shoulder socket. And we like to use this anchor because we have much less room in the glenoid than we do for the rotator cuff. And this little tiny anchor, although it's very, very strong, gives us plenty of purchase in the hard bone of the glenoid so that we can fix the torn ligaments, labrum, biceps, things like that back to the bone.